Are you taking time to teach residents some of these things that you've learned that like, because I think you have that benefit of being in private practice and kinda holding that
Yeah.
patient experience where it really matters in that setting, and then you're also going and working with them. I also think sometimes there's just so much has to get done in that setting that it's kinda hard to make space for that too.
It's hard. They don't see that aspect. I bring patients to the hospital, like I bring my orthognathic patients to the hospital. They're my private patients and they operate with me, but they don't come and shadow me in the office, most of them, to see how I speak with these patients. And let me tell you, before orthognathics, I spend multiple appointments leading up to the surgery, but I have a
Right.
dedicated pre-surgical discussion appointment, which takes like an hour at least. And I have very detailed instructions that I've compiled over the years to address every single thing that could pop into their head and occur to them and come up post-op. And I spend so much time preparing them. You're going to be super swollen. You're going to have nosebleeds. You're going to, you're not able to talk. And this is what you have to do. And this is how you take your medication. And my patients are so like over prepared. And I wish the residents would come and see this. But they tell me, the residents tell me that in the hospital post op, my patients do amazing post op and they say they're very low maintenance because my patients are already like they know it's coming. As opposed to there's another doctor that I used to work with who didn't really spend a lot of time with these patients post op. And every single one of those patients, unfortunately, I remember seeing his patients post op. They were crying,
Mhm.
emotional mess because they're like, oh my God, everything is like a huge surprise and nothing like they thought. And that taught me such a valuable lesson about emotional preparedness. Really, that's the secret. And that's all we did differently,
Mhm.
you know? And so the residents would see the difference between how this doctor's patients would do in the hospital post-op for those, 24 hours they took care of them and mine. And I would tell them how I do it, but they never saw me in action. But hopefully it's making some kind of impression.